Good evening. This is Dr. Bella Kaiser. I represent Skokie Institute of Allied Health and Technology. We are presenting here today a short webinar, 6 to 10 minutes webinar, and the purpose of the webinar is to educate our community and our students about Breast Cancer Awareness Month. As we all know, that Breast Cancer Awareness Month is October. The purpose of the awareness is to educate the community and the population about the disease and also how to prevent it and ways of how to prevent it. So, a little bit about our institution. SIAHT is Skokie Institute of Allied Health and Technology. It's a nonprofit education organization that strives to provide the community with hands-on training and education leading independence in the economic independence and entry-level positions. We are an online institution, student centered and community centered organization. We are affordable and flexible and value our students and their career training more than anything. One of the main reasons why Skokie Institute of Allied Health and Technology has been awarded in two straight consecutive years in 2017 and 2018 as the best higher education institution, because we don't only work with the students, we also work with our community. Our purpose is to be an institution that will educate our community of all health related issues and how to prevent them. The fall term and winter terms of 2018 will be starting soon. If you would like to register, and I hope you do, and I hope you would consider being with an institution that has been awarded the best higher education institution. Um, October 15th is the fall term, and the winter term starts November 12th. You can register now on our website, which is here, https www.siaht.org, or you can also email us at the executive director at admin@sayat.org. We also offer students scholarship, but in order to apply, the student has to then contact the executive director, and then based on that, um, we will provide them with an application. The application needs to be filled out, and once they provide us with the essay, depending on how good it is, and once approved by the board of directors, students can then get scholarships. The scholarship basically pays for the first two terms, and then the third and the fourth term, the last two terms, the student studies for free, pays for it. So what is breast cancer awareness risk factors? Well, the first risk factor is that you are a female, you are getting older, you have a family history, genetics, having children after 30, you are overweight, high socioeconomic status, having first period before 12, and then another big one is not breastfeeding. Now, if we look at all these risk factors, we would say that, yeah, okay, you're a female. Breast cancer also have been known to occur in men. So getting older, if you're over the age of 45, you have more chances of getting breast cancer. Family history is a big one, because if you have in your family a relative which is from your bloodline, like your mother, your aunt, or your mother, your mom's sister, or your dad's sister, you have higher chances of having the risk factors of breast cancer. Children after 30 years of age also puts you prone to getting breast cancer. And then not breastfeeding. Breastfeeding actually prevents a woman from getting breast cancer. So a little bit of breastfeeding, depending on how much a woman is able to do, a mom is able to breastfeed her kids, or nurse her babies, also puts her in an makes gets her prone to getting breast cancer, and as compared to a woman who has, or a mom who has never breastfed her baby. Test and screening. The test and screenings that we use are mammography, which is really important after beginning of year, once you turn 40. Clinical breast exam. Breast exam can be done by you or by the exam can be done by you or uh, by the physician. You can do as a woman a self breast exam. Every 3 years, you need to have a clinical breast exam done also through a physician when you are at the age of 20 to 39. Treatment, basically surgery. If you are diagnosed with a breast cancer lumps, lumpectomy or mastectomy, which may be partial or whole, is the treatment through surgery. Radiation, radiation treatment, X high energy, which includes high energy X rays, which actually are usually coupled with surgery. So once a woman is diagnosed with breast cancer, she gets a lumpectomy first, and then with that, she gets surgery. Chemotherapy is anti cancer drugs, which are used after radiation and surgery. Hormonal therapies, depending on the cancer, if the cancer is really prone to hormones or your women hormones like follicle stimulating hormones or luteinizing hormones. A lot of the tumors in the breast feed on that, and if that is the situation, then doctors will also prescribe hormonal therapies. Targeted therapy is another one. Specific molecules in the cancer cells or during that destroying process are attacked to prevent the woman from getting cancer again and also from killing the cancer cells. So, so this was a small informal introduction about about breast cancer. Now, Breast Cancer Awareness Month is October. It's also referred to in the United States as National Breast Cancer Awareness Month, and it's an annual international health campaign organized by major breast cancer charities every October to increase awareness of the disease. And it also raises funds for research into its cause and prevention. I mean, we almost know what the cause of breast cancer is. The main purpose now is how to prevent it, because breast cancer is one of those diseases that is diagnosed every year, and the amount and the number of women who are diagnosed with breast cancer are expected to increase every year. So the purpose of the research is to research in order to prevent it. So what is the connection to SIAHT? Skokie Institute of Allied Health and Technology has programs in fitness training, nutrition and wellness coach, and also in allied health. Our program, Nutrition and Wellness Coach, Health Coach, and our fitness training program teaches students about health, aging, and disease. And it also teaches nutrition cases and nutrition formats for clients. The purpose of presenting this webinar to you was to let you know that uh, our nutrition and wellness coach program also prepares the student in providing with meal plans and helping a client that is coping with breast cancer at that time. Students, once they graduate, can work with nutritionist, dietitian, or a dietitian, dietetic assistant, and in gyms as nutrition coaches, in coordination with the trainers. The program overall is 10 months long, and there are 4 terms that the student has to take. That is the last class, is the internship, in which the student is provided with real-time cases, and they have to prepare a meal plan for the patients, keeping in mind the medical diagnosis of the clients. So why this connects is because we are a community and a student-based organization, and our main focus is health and fitness. So our main focus in giving you these small highlights is also letting you know, is also making you aware, giving our society and our community, making them aware of the importance of knowing what breast cancer is and how to prevent it. We have been awarded the best higher education in 2017 and 18. And as a student, you are studying and getting help with the best institution that also is included in the Business Hall of Fame. Our website, all the information you would want to have is on our website. You can contact us at admin@say.com at this number. You can also visit us in person by making an appointment. We have contact form on our, so you can fill this form out, and one of our staff members will get in touch with you for an appointment. Any questions, please do not hesitate to call me, 847 We are Skokie Institute of Allied Health and Technology, and I am Dr. Bella Kaiser, who is the Executive Director of this institute.